Okay. This is a press statement on the non-recognition of the National Health Insurance Scheme membership card as a means of payment for services within health institutions of the Christian Health Association of Ghana, CHAG. The statement is delivered today, Thursday, 29th May 2014, at the 46th Annual General Meeting of the Christian Health Association of Ghana, held at Capital View Hotel, Koforidua, Eastern Region. The National Health Insurance Scheme, NHIS, is, no doubt, one of the best social intervention mechanisms introduced in Ghana. This is evidenced generally by the ever-increasing healthcare accessibility figures recorded at health facilities throughout the country. We commend the government's effort at sustaining the scheme to improve universal access to affordable quality health services for all residents in Ghana. Indeed, this is in line with the equity values and the healing ministry of Christ philosophy of the Christian Health Association of Ghana, CHAG. We further acknowledge government's determination to introduce innovative ways to manage the scheme in spite of financial challenges it faces. Unfortunately, the NHIA has repeatedly delayed in the payment of claims to service providers and is currently indebted to our member institutions an average of 5 to 6 months claims. The current NHIA tariffs are low, that is, below the market price of required inputs for services. Review of tariffs for services and medicines takes long. For example, medicines tariffs were last reviewed in March 2013, and that for the Ghana Diagnostic Related Groups, GDRG, as far back as 2012. None of the tariffs have kept up with inflation. The low tariffs and delayed payment have resulted in significant financial challenges to the CHAG institutions, making their ability to remain financially sustainable near impossible. The situation is further compounded by the recent introduction of VAT of 17.5% on the cost of some medicines, which is not reimbursed by the National Health Insurance Authority. The current capitation model is also defeating the national policy on primary health care and reducing geographical access to quality health services in rural and hard-to-reach communities because the available clinics are unable to continue to provide services. Additionally, there is no functional contract between the National Health Insurance Authority and CHAG facilities. The relationship between the two parties has been premised on good faith and the desire of both parties to ensure the availability of quality health care to the people of Ghana. This has been to the detriment of CHAG institutions, since the NHIA assumes no liability for not fulfilling its part of the partnership, such as scheduled payments and economic tariffs. The current situation has resulted in the following. 1. The hospitals and clinics are unable to meet their financial obligations, in particular, the payment of salaries of non-mechanized staff. 2. There is an increasing shortage of essential drugs, medical and surgical supplies, owing to suppliers legitimately refusing to grant further credits to these facilities due to non-payment of outstanding bills. 3. Patients are compelled to take prescriptions to purchase medicines, even in emergency situations, from pharmacies and other outlets outside of the health facility, compromising the delivery of effective, efficient quality of care. 4. Hospitals are resorting to bank overdraft facilities for funding of essential medical supplies against unfavorable bank interest rates, making the actual cost of health services to increase. These additional costs are not captured by the NHIA tariffs. 5. Hospital managers are continuously being harassed by their creditors and often threatened with court actions. 5. The quality of health services provided by CHAG health institutions is being compromised, much against our avowed commitment to provide the highest quality of care in line with Christ's healing ministry. CHAG has engaged key stakeholders at all levels towards finding a sustainable solution to these challenges of the NHIA and the adverse effect it is having on the provision of quality of health services by health service providers in general and CHAG health institutions in particular. CHAG Secretariat has engaged the NHIA severally on issues of delayed payment, capitation, low tariff, lack of binding service provider contract arrangements since 2012. In January 2014, the CHAG Secretariat participated in a meeting held with the Honourable Minister of Finance as part of a team of service providers and other relevant agencies of the Ministry of Health at the invitation of the Honourable Minister of Health to discuss the effect of the delayed payment of claims by the NHIA and requests for prompt payment of National Health Insurance Levy to the National Health Insurance Fund and onwards to the National Health Insurance Authority to enable service providers be paid. In February 2014, the Ghana Catholic Bishops' Conference, the Christian Council of Ghana, and the Ghana Pentecostal and Charismatic Council, the owners of CHAG, wrote to His Excellency, the President of the Republic of Ghana, through the Honourable Minister of Health, informing him of the current situation and requesting him to intervene to prevent the imminent collapse of CHAG health institutions and the impact it would have on access to service delivery, particularly of rural, deprived, and hard-to-reach communities. In March 2014, the Ghana Catholic Bishops' Conference, the Christian Council of Ghana, and the Ghana Pentecostal and Charismatic Council, the owners of CHAG, held a meeting with the Honourable Minister of Health to follow up on their letter to His Excellency the President of the Republic of Ghana. These interventions have yielded temporary relief in that government has made some payments to CHAG institutions and other service providers as a direct result of these engagements. The repeated pattern of 5 to 6 months delays in payment of submitted claims continues, and the issues of tariff review, capitation, and revised contractual framework all remain unaddressed. CHAG makes the following recommendations to the Government of Ghana in respect of the current situation facing the National Health Insurance Authority and service providers. 1. The NHIS fund is to be purposefully applied. The National Health Insurance Fund was set up to mobilize resources for the efficient management of the National Health Insurance Scheme. However, we are informed that the funds are not fully released, and when and what is released is not done on time to enable the NHIA pay claims promptly. Section 52 of Act 852 requires the Minister of Finance to cause all collections for the National Health Insurance Fund to be paid within 30 days to the fund. CHAG is saddened by the lack of clear commitment by government to adhere to the requirements of the law. We are dismayed by this recurring situation, which is a source of great frustration to healthcare managers and is slowly causing the collapse of our health institutions. CHAG recommends that the receipts from the NHIL be restricted to the National Health Insurance Fund and be solely dedicated to financing the National Health Insurance Scheme. 2. Insufficient revenue generation. CHAG recognizes that the revenue generated by the National Health Insurance Levy is inadequate to address the expenditure requirements of the National Health Insurance Authority in meeting claims reimbursement to service providers.